Good afternoon, dear colleagues. In the last study research performed among the injectable drug users, half of the sample from Chisinau and some 1/3 from Belts stated that they have consumed non-injectable drugs and non-injectable psychoactive substances, illegal substances in forms of dust, crystals or pills. Until recently, the prevention programs were not rendering services to the non-injectable drug users. And because of the modest data about the behaviors of these persons, about the extent, needs and scope of this group in general. In response to the need for such data, in 2022, the integrated biobehavioral study among this group has been performed with the objective of measuring the types, the frequency, the model of drug use, and to identify the profile of non-injectable drug user, the accessibility and use of services for the treatment of drug addiction, and to measure the HIV prevalence and prevalence of viral hepatitis B and C and syphilis. And the most necessary, maybe, thing to estimate the extent or the amount of this population, the number of this population. This study has had as a target group people older than 16, but have consumed illegal substances in the last 1 month. The sample was of 1,000 people, 4 sites of study, 2 in Transnistria. At the screening stage, the urine tests were used in order to reveal the presence of drugs in the body of the persons before their acceptance in the study. And the staff involved in data collection were women, men, and also representatives of the drug user community. We used the respondent-guided sampling method, which is based on probability, making a reference from peer to peer, and this method is usually used to collect data from the hidden populations, which are interconnected by some networks. This sampling starts with the selection of several seeds or primary respondents. It is to mention that the components of a final sample is independent of the characteristics of these seeds or primary respondents, and the recruitment process lasts as long as it is necessary to attain the calculated dimension of a sample. Here, you can see the recruitment chains for the 4 study sites. I would like to mention that the largest number of waves was in Chisinau municipality. We had 13 waves of recruitment. As I was saying, the final sample is independent on the characteristics of the primary respondents. Here we have 3 seeds, primary respondents. You can see them in big green squares. Green means that they were HIV negative. The sample produced by the 3 seeds was 300 persons. The HIV prevalence in the final sample was approximately 7%. Most of the sample was represented by men, 22% of women only. The age of almost half of the sample was more than 40 years. In Tiraspol and Belts, we recruited also a younger segment. One quarter was aged 24, approximately. Speaking about the urine tests used at the screening stage, most respondents had in their bodies tetrahydrocannabinol, in proportion of 72%, followed by benzodiazepine 34% and ketamine 23%. At the same time, the respondents stated that the most frequently used drugs in the last months were the psychoactive illegal new substances in form of dust, crystals or pills, 72%. The HIV prevalence in the sample varied from 5% in Tiraspol to 8% in Belz. The largest prevalence of C hepatitis was recorded in Chisinau. The largest prevalence of syphilis was recorded in Ribnica, some 7%. Women drug users had a prevalence 2.5 times more to HIV and twice higher for syphilis as compared to men. And men have had a substantially higher percentage for hepatitis type C as compared to women. Because the recorded HIV prevalence during this study was quite high, we have done a bivariate weighted regression in order to examine the values with which the HIV positive persons associate with. This analysis have shown that the non-injectable positive users, drug users, were mostly from Belz and not from Chisinau, and more often they were women and not men. And their age was more than 25 years. They have had multiple partners. They didn't use condoms during the last sexual contact. They have had sexual contacts while being under drug. And they have injected some time in their life drugs and have had hepatitis type C. Speaking about the dimensions of this population, we have used several multiplication service methods, service multiplier, unique object multiplier, data about worldwide estimations about the number of non-injectable drug users, and the successive sampling method that uses data about the dimensions of the social network of the respondents. Within this method, we incorporate some preliminary knowledge about the dimension of the sampled population. Every city of study, according to the estimation using the multiplier method, was classified as a settlement with a high, middle, or low prevalence. The proportions varied from 3 to 6% of the adult population. After that, the last stage was classification of the rest of locations where the study has not been performed, and they have been divided into 3 categories. With a allocation of 6% of adult population for the districts with a high prevalence, 3% for the middle, and 2% for the low prevalence. And when we applied the percentage to the adult population, we have done the estimations and presented them to the working group. And they were agreed, and the working group came to a number of approximately 50,000 people consuming non-injectable drugs, of which 8,500 on the left bank of Dnistru in Transnistria and 41% on the right bank. The study has given some recommendations because the drug users have strong networks, so it is necessary to use peer-to-peer modalities in prevention programs and other interventions. And it is also necessary to identify some creative modalities for treatment which would satisfy the needs of women drug users. And qualitative studies should be done among the women drug users, taking into account of the early start of drug use. It is also necessary to perform activities for youth to promote a healthy lifestyle. At the same time, the high HIV prevalence among the non-injectable drug users should be approached immediately with corresponding training program activities, testing, treatment, and care. And of course, the repeated performance of a similar study with the same target group and the same sampling method.